we've got to find a way to help, control overall costs. And so if you think about the cost of healthcare and what drives the cost of healthcare, it's really two things. It's how much are you paying for it and how much are people buying, or what we would call unit cost and utilization. So we've got to figure out a way, especially under the ACA, to make sure that we either have everybody that needs to be in there paying into the system, or we figure out a way to reduce the overall cost of claims that are going out. So from a pure ACA perspective, we got to see some changes in the market that I think are slowly going to come. When it comes to the commercial market as a whole and the employer market as a whole, that's doing really well. I mean, if you think about what employers are trying to do now these days, it's all about engaging their members. And if you're going to control utilization, how much people are utilizing their healthcare and appropriate utilization of healthcare, you've got to have that member engaged. You've got to give enough information. Our tagline is we try to help people live healthier lives. And that's really what drives utilization down and helps make healthcare more affordable for everybody. Well, I think an interesting, obviously just happened last week with the announcement from Amazon and JP Morgan and Buffett. So, they come out there and talk about we're looking to ways to change how those 1.1 million members in their three companies' plans kind of engage in healthcare and how we can drive down cost. A big part of that has to be data. And so the interoperability, the interconnectivity of the data across all the players in the market, to me, is one of the biggest game changers we could have. You've got EMRs, electronic medical records, that between different systems that doctors and hospitals that don't talk to each other. You've got systems between providers and payers that don't talk to each other as well as they should. You've got systems between payers as we transition members from United Healthcare commercial to a Medicaid or a Medicare plan down the road, or Cigna or Aetna, pick your favorite commercial payer, into another type of coverage as they either age out or change jobs or do something else. So the more interconnectivity we get in that system, I think that's going to help drive down cost. And where the data comes into play is the more we know about how a member as a patient engages with healthcare, how they buy healthcare, how they work with their physician, with the hospital, with an outpatient clinic, with an emergency room. The more we know about that and everyone within the system knows about what everybody else is doing, that'll obviously help drive down cost as well, because what we're trying to do is avoid unnecessary cost. And so if we know that someone has already done these three tests, and we can get the test results shipped from one physician to another or from the hospital to a primary care physician, then they don't have to do it again. There's a lot of waste in the system because data doesn't flow as easily as it should. If you think about comorbidities, so smoking is a lifestyle choice. And depending on whose numbers you believe, it could be United Health Foundation's or anybody's, somewhere between 50 and 70% of healthcare costs are based on lifestyle choices. Smoking is a big chunk of that, non-compliant diabetics. But if you look at smoking specifically, COPD and all the other things that, asthma, all the things that come with, that are more prevalent with smokers than non-smokers, it's a huge issue. United Health Foundation does America's Health Rankings every year, and they rank every state based on a whole bunch of criteria. And if you think about smoking and obesity, Kansas, Missouri, Iowa, and Nebraska, smoking rates have declined, but not at the rate of many other states, especially if you go to both coasts. But the other thing that's interesting is since 1990, obesity rates have tripled. And so if you think about lifestyle choices and obesity, that's a key issue. Well, I hate to say this, but it's the 80-20 rule, or really it's more the 90-10 rule. It's 10% of the population that's driving 90% of the cost in most cases, especially true in the commercial book of business. It's a little different if you think about, say, CanCare or just Medicaid in general or Medicare in general. But if you've got that 10% of the population and you can just impact a small number of that, a 1% change in the number of high-cost claimants potentially has a 9 or 10% impact on the overall cost to everyone else for that 90% that's really paying in and subsidizing those high utilizers. So obesity is a key issue of that. Diabetes and being compliant from a diabetic perspective, smoking are probably the three biggest drivers overall of things that you can do from a lifestyle choice that will help everybody save money over time. What Jamie Dimon and Buffett and Bezos are looking at is it's a big hurdle to jump over, because the cost of getting into this space, jumping in with both feet is huge. You've got all the issues to deal with from a data perspective. You've got the issues to deal with from connecting, 6,000 hospitals and hundreds of thousands of physicians all over the country and building a network that's broad enough to cover not just their 1.1 million employees, but everybody. That's where I think that the traditional payers like United Healthcare can help them accomplish what they want to do. Where I think they can truly help is to put some money behind the investment in technology and make sure that we've got the right type of technology and if you think about Amazon, I mean, when's the last time? Name one person in this room that hasn't bought something on Amazon in the last month.
From Amazon.
I'm going to say Amazon Basics right there. So who hasn't bought something from Amazon? And what they've done is made it so simple, and people are so used to that technology. If we take something similar to that and put it into healthcare, when it comes to deciding where I want to go and have something done, when it comes to deciding, you know, what about my follow-up appointments? How am I communicating with my provider? How am I communicating with my employer? Wrapping that into one package, I think that's where it becomes exciting with Amazon getting involved.